Have you spent years hearing about the G-spot, but never really been sure if it's actually real, or just something invented by magazines, movies, and the internet? Have you ever quietly worried that you don't really know how to give a woman pleasure anymore, especially now that both of you are older and her body doesn't respond the way it used to? You're not alone. Most men your age have never had this explained clearly at all, and many walk around feeling like they're failing women for no good reason. The word G-spot gets thrown around everywhere, but the real story is much more complicated than a single magic button hidden inside the body. Female pleasure doesn't come from one tiny switch that you either find or fail to find. It comes from a mix of anatomy, sensitive nerves, good blood flow, hormones, past experiences, and how safe, relaxed, and emotionally connected she feels in that moment. In this video, I want to strip away the myths and confusion. We'll talk about what we actually know about the so-called G-spot, what it is, and what it isn't, and then focus on what really matters for a woman's pleasure, especially in midlife and older age, so you can stop guessing and start understanding what actually helps. This matters even more after 50 or 60 because both of your bodies and your lives have changed. For many women, menopause brings big hormonal shifts. The vagina can become drier, the tissues thinner and more sensitive, and spontaneous desire often drops. So arousal usually takes longer and needs more gentle warm-up. At the same time, many men start feeling more anxious about performance, worried about losing erections, or afraid of hurting their partner if she's in pain, which can quietly chip away at confidence. Add to that the emotional reality of long relationships that have gone through illness, stress, or distance, or the challenge of being with a new partner after divorce or widowhood, and it's very easy to feel like you don't know what to do anymore. Understanding how female pleasure really works at this stage of life isn't about trying to be a teenager again. It's about giving both of you more comfort, safety, and confidence right now. You've probably heard about the G-spot, this mysterious button that's supposed to send women into waves of pleasure. But what is it really? Let's cut through the myths. The G-spot isn't some magical spot hidden deep inside the vagina. It's actually an area on the front wall, just a few centimeters in, closely connected to the clitoral tissue and the urethral sponge. For some women, stimulation there feels incredible, intense, deep pleasure that can even lead to orgasm. For others, it might feel nice, but not earth-shattering. And for some, it doesn't feel all that different from anywhere else. Here's the thing, if your partner has never had a G-spot orgasm, it doesn't mean she's broken. And it definitely doesn't mean you're doing something wrong. Every woman's body is different, and pleasure isn't one size fits all. The G-spot isn't a guarantee, it's just one part of a much bigger picture. So let's talk about what this really means for you and your partner, and how to explore pleasure without pressure or expectations. Because the best sex isn't about finding one spot, it's about discovering what feels good together. So what does science actually say about the G-spot? Is it a real, distinct structure, or just a sensitivity zone? The truth is, scientists don't all agree on the idea of a single button hidden inside the vagina. But here's what we do know. The area often called the G-spot is packed with nerve-rich tissues and blood-filled structures, closely connected to the clitoris and the urethral sponge. For many women, this region is more sensitive than others, and stimulation there can feel intensely pleasurable. But, and this is important, it's not a universal on-off switch. Some women feel a lot there, some feel a little, and some don't notice anything special at all. The bottom line, there is a sensitive zone in that area for many women, but it's not some magical spot that works the same way for everyone. The real secret isn't about chasing down a mystery spot like it's buried treasure. It's about understanding how her whole system works, how her nerves, blood flow, and even her mood all play a part in pleasure. Because when you focus on the bigger picture, you take the pressure off, and that's when the real fun begins. If you've been fixating on the G-spot as the key to female pleasure, you might be missing the bigger picture. The truth is, female pleasure is about so much more than just one spot. Let's break it down. The clitoris, both its external and internal parts, plays a huge role in arousal and orgasm. In fact, most women need clitoral stimulation to reach climax, whether that's through direct touch, indirect pressure, or even internal stimulation that engages those hidden nerves. But pleasure isn't just physical. Arousal and lubrication take time, and they thrive in an environment of safety and comfort. A woman's brain and emotions are just as important as her body. Feeling wanted, relaxed, and unrushed makes all the difference. And here's something especially important for older women. As bodies change with age, pleasure often requires more warm-up time, more lubrication, and less pressure for an instant response. It's not about what's broken or missing, it's about adapting to what feels good now. So if you're focusing only on the G-spot, you might be overlooking the 90% that matters even more. Real pleasure comes from understanding her whole body, her mind, and the connection between you. It's not about finding one magical spot, it's about creating an experience where she feels all of herself, not just one part. And when you do that, everything else falls into place. Let's talk about the common mistakes men make when it comes to the G-spot, because sometimes, the harder you try, the more you might be working against yourself. First, there's the issue of poking or pressing too hard too soon. The G-spot isn't a button you push to unlock pleasure. It's a sensitive area that needs gentle, patient exploration. If you're going in like you're trying to find a hidden treasure, you might end up making her uncomfortable instead of aroused. Then there's the mistake of treating it like a test. Did you feel it? Did you orgasm from it? This puts pressure on her to perform or react in a certain way, which can actually make it harder for her to relax and enjoy herself. Another big misstep: ignoring her words and reactions and following a porn script instead. Porn isn't real life, and what works on screen doesn't always translate to the bedroom. Pay attention to her, not to some pre-written idea of how things should go. And finally, never assume that if she doesn't react strongly to G-spot stimulation, she's not enjoying sex. Pleasure comes in many forms, and her enjoyment isn't defined by one spot or one type of orgasm. The irony is, many men try so hard to find the G-spot that they actually make their partner tense up, which makes it even less likely she'll feel anything at all. The key is to focus on connection, not just technique. Listen to her, take your time, and remember, the goal isn't to find the G-spot. It's to explore pleasure together, without pressure or expectations. When you do that, everything else becomes a lot easier and a lot more fun. If you and your partner are curious about exploring the G-spot, the best place to start is with a simple conversation. Ask her if she's open to it, and make sure you're both on the same page. Consent and comfort are the foundation of any pleasurable experience. Once you've talked about it, focus first on building overall arousal, kissing, touching, clitoral stimulation, and plenty of lubrication. The goal is to help her feel relaxed, turned on, and ready for exploration. When you do explore inside, use clean, lubricated fingers and start with gentle, slow pressure on the front wall of the vagina. Pay close attention to her feedback, both what she says and how her body responds. If she feels pain, burning, or any discomfort, stop immediately. This isn't about pushing through or trying to force a reaction. It's about discovering what feels good together. The key is to approach this as a shared adventure, not a test you need to pass. There's no right or wrong way to do it, just what feels good for her and what feels good for you as a couple. When you take the pressure off and focus on connection, exploration becomes something enjoyable, not stressful. And that's when the real magic happens. For older women, exploring pleasure, including the G-spot, can come with some unique challenges. As women age, hormonal changes like lower estrogen can lead to vaginal dryness, thinning of the tissues, and sometimes even pain during sex. Nerves may also respond differently, and what once felt pleasurable might now require a much gentler touch. But these changes don't mean pleasure is off the table. They just mean you might need to adapt your approach. The key is to prioritize comfort and communication. Use plenty of lubricant to reduce friction and discomfort. If she's experiencing pain, it might be worth talking to a doctor about options like vaginal estrogen, which can help restore tissue health and reduce discomfort. And remember, older women often need more time to warm up and may prefer shorter, gentler penetration. It's not about rushing to a finish line, it's about enjoying the journey together. Here's the most important thing to keep in mind. If she's in pain, it's not a G-spot problem, it's a health issue that can often be treated. There's no need to suffer in silence or assume that discomfort is just part of getting older. With the right care and attention, intimacy can remain a joyful, fulfilling part of life at any age. The goal is to make sure she feels good, physically and emotionally, so you can both enjoy the experience without worry. There are some red flags you should never ignore, because pain or unusual symptoms during or after sex are not normal, and they're not something to push through. If your partner experiences sharp pain, or if the pain lingers long after sex is over, that's a sign something's wrong. The same goes for bleeding that isn't tied to a known cause, like her period. And if there's burning, unusual discharge, or a strong odor, those are not just minor inconveniences. They could signal an infection, vaginal atrophy, prolapse, or another gynecological issue that needs attention. Here's the hard truth. Pushing through pain isn't brave. It's one of the fastest ways to destroy trust, pleasure, and even her health. If any of these symptoms show up, stop experimenting and seek medical evaluation right away. Pain isn't something to work around or hope will go away on its own. It's her body's way of saying, something needs to be checked. Ignoring these signs won't just ruin the moment, it could make things worse. But the good news? Most of these issues can be treated, often easily, once you know what's going on. So if something feels off, don't guess. Don't wait. Get it checked out. Because real intimacy should never come at the cost of her comfort or well-being. When it comes to what really makes sex satisfying for many older women, the answer might surprise you, because it's not about hitting some magical spot or chasing an explosive orgasm. What matters most is feeling emotionally close and safe with you. It's about being touched in the way she actually enjoys, the ways you've talked about together, not what you assume she should like. It's about taking your time, without rushing or making her feel judged for how long she takes, or whether she orgasms at all. For many women, especially as they get older, comfort and connection often mean more than any kind of fireworks. It's the gentleness, the trust, and the feeling of being truly seen and desired that makes sex deeply satisfying. It's not about performing or meeting some imaginary standard. It's about being present with each other without pressure or expectations. And here's the truth most couples discover. The real secret spot isn't a physical place at all. It's good communication. It's asking, does this feel good? And listening to the answer. It's creating a space where she feels free to say what she wants or doesn't want without fear of judgment. Because when you focus on her, not just her body, but her heart and her mind, that's when sex becomes something truly special. And that's something no G-spot can ever compete with. There are times when the best thing you can do for your partner and for your relationship is to encourage her to see a doctor. If she's experiencing ongoing pain, dryness, or simply feels no pleasure at all, it's not something she should have to just live with. The same goes if she's carrying fear or trauma from past experiences, which can make intimacy feel overwhelming or even impossible. These aren't issues she can, or should, face alone. A gynecologist, pelvic floor therapist, or even a sex therapist can offer real help, whether it's addressing physical discomfort, hormonal changes, or emotional blocks. And here's something important to remember. It's not just her age or her fault. These are real, treatable issues, and seeking help is a sign of strength, not weakness. If she's hesitant, consider going together. Offering to accompany her to an appointment can make the process feel less intimidating and show her that you're in this as a team. It's not about fixing her, it's about supporting her. And when she feels supported, trust grows stronger and intimacy becomes something you both can enjoy without worry or fear. Because at the end of the day, the goal isn't just better sex, it's a happier, healthier connection. So let's wrap this up with what really matters. The G-spot is a sensitive area for some women, but it's not a magic button that works the same for everyone. The key to great sex isn't about chasing myths or focusing on one spot. It's about whole-body arousal, comfort, and open communication. It's about understanding what feels good for her and enjoying the journey together without pressure or expectations. And here's something to think about for next time. Did you know there's a common habit many men have in bed that quietly reduces her pleasure and your confidence, without you even realizing it? Or maybe you've wondered how certain health issues, like prostate problems, bladder concerns, or even medications, can affect not just your experience, but your partner's as well? We'll dive into one of these topics in the next video, so make sure you're subscribed and hit that notification bell. Because when you understand the full picture, you can make small changes that lead to big improvements for both of you. Until then, remember, the best sex isn't about finding a secret spot. It's about creating a connection where you both feel good, inside and out. Take care, and I'll see you in the next video.